So hello everyone. So we are going to present on the topic of analysis of recovery and fatality of COVID-19 data using several visualizations. So for our source of this data, we got this data from the Kaggle dataset, and along with myself, Abinash, I got my team members Kopita, Kranti, and Nizara Dagal. So I would like to thank Mr. Dr. Jeshi for this opportunity. So in the COVID-19 dataset, we have filtered the data using Excel and the Tableau software itself. So we have replaced the null values with 0 in the new cases, especially in the new and active cases. There were a lot of new null values which were replaced, and then serious critical patients, since the latest numbers are really low, so those numbers have been replaced, and the other calculated field have been created in terms of death per million and case fatality rate as well. So moving forward, we can see over here that in the So we can see over here that in the death per million and the case fatality rate, it is a new calculated field with the thing being described as a total number of cases divided by population times 1 million, which is the fatality rate. And then there were several numbers which have been filtered. They were actually in the alphabetical form, so they have been changed in the form of numeric sector or numeric number, which is whole number. So they were previously in the before filtering this data, they were in the alphabetical format, so they have been changed. So moving towards the first visualization, which is seen as a total number of death and cases by country, which is the geographic visualization. So when we first click on the country, it created a map of the entire world, where we then added the total number of cases, and total number of deaths. So we can change the color of it as well. By moving towards the color and edit the colors, we could change it, let's say to orange and blue and white diverging. So we can see that the color has changed. But and then we decided to add the total number of deaths into the size sector, the total number of deaths, and then a country in the detail, and country in the detail sector. So which shows that the darker the color is, or the darker the dot, especially the blue dot, the darker it gets. It means it has higher number of cases, it has plus the higher number of deaths it has. So it refers that in the visualization, it can be spotted that a lot of countries have small dots. So that means it has less number of cases plus less number of deaths. So this basically has filtered the size factor, or the total number of deaths has basically filtered the data by among the total number of cases, which has or the country which has highest number of deaths have been morely highlighted. So India, Brazil, and USA are the countries that has most number of highest deaths. So USA, it has most higher number of deaths, which is almost 1.1 or 1.2 million, and then Brazil comes second, and India, Russia, they are also one of the countries with highest number of cases. So whereas the country with some small dots are visible over there, but there is no deaths. So these are very minor dots, which is filtered by the function size. So we can change the background images or background layers using the background layers. We changed it and we selected it to dark module, selected the base, landline, terrain, coastline, county, stages, water levels as well, and neighborhoods as well. so which is explained in the dashboard as well. Total number of case and death per country. It is seen that the total number of deaths in terms of the geographic visualization through the small blue as well as orange plots, and then so using the bar graph, it can be seen that the top 10 countries with highest number of cases and highest number of death have been reflected in the bar graph, where the detailed description of this one will be given by my friend.
Hi, my name is Nishala Dakal. I'll be presenting the bar chart where after filtering, I decided to visualize total cases and total deaths among 10 countries in a bar to create a bar graph as per the total cases and total death, where 10 countries with the active COVID-19 cases are presented along with their number of deaths. We dragged total cases to column and country to row, and total death to color to filter. So for the top 10 countries with the highest number of COVID cases, um, but the most active one, we clicked right off the country where we went to edit filter. We have general options, but we went to top and then click 10 and selected by field. After doing that, we press OK, and after doing that, we drag total death in a color filter out of the total number of cases, where we maxed it in which countries are presented, and then we sorted this data in a chart in a descending order. Moreover, the countries with the highest cases and death is USA, whereas the country with highest cases of COVID among top 10 countries with the maximum cases is China, but it has least number of deaths report. So we have linked these two visualizations, one geographic, one bar diagram in the dashboard. So it can be seen that the countries with the darker dots are the same countries with the majority of deaths. After this, further parts will be explained by my other team members. Thank you.
Hi everyone, my name is Kranti Subedi and today I will be talking about the scatter plot from our COVID-19 analysis. Let's start with how we created this visualization. We use Tableau and connect our COVID-19 dataset. Firstly, we drag the case fatality rate to the column section and death per 1 million to the row section. And then we change the mark type to circle so that each country would be represented as a dot on the graph. To make sure we could identify each country, we added the country field to the detail section. Finally, we added a trend line to see if there is any overall pattern in the data. Now let's take a look at our visualization, which shows the relationship between the case fatality rate and death per 1 million population for various countries during the COVID-19. The x-axis tells us how deadly the virus was and the y-axis shows how many people died per million in each year. Each dot represent one country. We can see that the trend line goes slightly upwards, which means countries with higher death rates also had more death per million people, but not all countries follow this exactly. Some had fewer death even with a high fatality rate, and some had more death with a lower fatality rate. Overall, this scatter plot gives us a simple way to compare the impact of COVID-19 across countries and understand how the virus affected different parts of the world.
Hi, this is Kavita, and now let's take a closer look at our pie chart visualization, which represents the top 5 countries by total COVID 19 tests conducted. The purpose of this chart is to show how testing was distributed among the top 5 countries globally. First of all, let's discuss about how we created this visualization in Tableau. We first filtered the dataset and uploaded the dataset into Tableau. Use the filter to select the top 5 countries and drag the country to color, sum total test to angle to define the size of each slice, and use the edit label to display both the country name and its percentage of total test among the 5 nations. The pie chart is very important because it simplifies a complex data set into an easily digestible visual that highlights a critical insight that COVID-19 testing was highly concentrated in a fewer countries. From this visualization, we can see that the United States and India together account for 60% of all the tests, with the USA contributing about 35% and India almost 28%, while the remaining countries like UK, Spain, and Italy make up significantly smaller shares. This visualization makes it easy to understand the global testing disparities without needing to interpret larger tables. It also raises equity-focused questions like, are some countries barely visible because of limited population, resources, or underreporting? So these gaps are very essential to identify when planning the public health strategies. From a communication standpoint, pie charts are intuitive and impactful, especially for a non-technical audiences, as they present a proportional data in a visual format that emphasizes scale, concentration, and inequality, which is vital for the global health policy discussions. In conclusion, our analysis reveals that the impact of COVID-19 was highly unequal across countries. Wealthier nations conducted far more testing but were also more exposed due to international travel and urban density. Meanwhile, the countries with limited testing often had higher death rates, indicating the possible underreporting or overwhelmed healthcare systems. So, based on these findings, we recommend that they expand testing infrastructure in low reporting or under-resourced countries, or use a per capita metric such as deaths per million to evaluate the pandemic severity more accurately. They can also implement a real-time data dashboard to support fast, informed public health decisions. Ultimately, this dataset shows how data visualization helps not only to understand the pandemic's impact, but also to guide future global health responses through clear, equitable, and data-driven strategies. Thank you.